are watching Ask Your Pediatrician, and of course, welcome to yet another brand new episode. And of course, today we want to concentrate much on excessively crying babies, and of course, a colic condition as well. And I'm joined by Dr. Kanta Chandwe, who is a pediatrician, who is going to help us look at the two issues that we have today on the program. Well, Doctor, thank you so much for coming.
Thank you, Nelson. Thank you for having me.
Excessively crying babies.
Yes.
Yes, it's a very common, scenario in many communities today. So maybe briefly tell us about this particular condition.
Okay, I'm glad that you picked on quite an interesting topic, actually. Like you said, it's a very common phrase that you hear. Even if you ask any parent or any individual who's had a baby in the house, you know that one of the complaints when there's a baby who's excessively crying, it's a very worrisome thing for not only the mother, but for the household. And so the question is, what could be causing this excessive crying? So the excessive crying that we are trying to talk about today is not the usual way that a baby tries to communicate, because we all know that when a baby wants something, what they do is cry, of course, because they can't speak. So one of the common reasons why they cry is maybe if they're hungry, if they need a diaper change, and so forth. But there are certain instances where you find, even when all those things are attended to, the baby just continues crying unconsolably. And so those are the conditions I was hoping we would zero in today.
Interesting. So now, when you are comparing between a normal cry of a baby, as the baby is trying to communicate to the mother, and excessive crying here, what is the difference between the two? Okay,
so in differentiating the two, there are certain things that you might want to look at, see what are associated with that crying. Like I said, if it's a common cry for hunger, you find that when the baby is breastfed, the crying will stop. And if it's crying, maybe the baby is uncomfortable in a wet diaper, after the change of that diaper, the baby will be consoled. But this is where you find the baby is very irritable and has this very high-pitched cry, which is unconsolable. Whatever you do, the mom can get up, walk with the baby, feed the baby, change the diaper, but the baby just continues crying for a prolonged period of time. So that becomes worrying. So in differentiating in between, is this just a normal cry for hunger or not? Apart from that, you can look for other things. Maybe you find that the baby has a temperature, or the baby has certain things that you might point to an infection. Then we know that this is not a normal cry for a baby.
Interesting.
Yeah.
So now, when should parents contact their healthcare provider or doctor when a baby is crying uncontrollably? Okay,
so there are things that we may term as red flags or danger signs that may point to the fact that maybe this child needs to be seen by a healthcare professional. So one of those that I mentioned, including things like fever, questions like, is the child having any diarrhea? Is the child having any cough? Is the child maybe just irritable? Is also just continuously being unconsolable, even after attending to all those other needs. So those, in addition to just the unconsolable, will prompt the mother to say, maybe I might have to seek medical attention to see what exactly is going on.
Is it a serious issue when a child is crying uncontrollably or excessively?
I would use the term concerning. Not really say serious, because it depends on the cause. So the causes might be, we can categorize them as, you have the medical causes of unconsolable crying. You can have surgical causes of unconsolable crying. So when I say medical causes, I mean things like infections. For example, if a child has a urinary tract infection, or maybe has an infection in the ear, which is causing some pain. The baby has diarrhea, which may cause abdominal pain. So it depends on really what's causing the pain. There are other serious conditions like meningitis, where that's a very serious condition, which is an infection in the brain. So that also causes unconsolable crying. So those could be like some of the medical causes, but there are also surgical causes, okay, which can cause pain. And those mainly, the common ones are the ones that affect the stomach and the intestines. By these, we're talking about maybe things that might need surgical intervention. Maybe the bowels are twisted and so forth. There could be constipation that is causing discomfort. So the seriousness depends on the actual cause of the uncontrollable crying.
Okay.
Yeah.
Interesting. In case you're just joining us, ladies and gentlemen, you are still watching Ask Your Pediatrician, and of course, my guest is Dr. Kanta, and he is a pediatrician as well, highly trained in the health of infants as well. And today we are looking at excessively crying babies, and of course, we are going to also zero in on colic condition as well, because it's very, very common and it has to be discussed as well. Yeah. Okay, so now, what are some of the basic steps that a mother can take in case she notices that the baby is crying excessively? What are some of, before she can even consult healthcare providers, doctors, what are some of the home remedies that she can definitely just take into account just to make sure that the baby at least is controlled?
Okay, that's a very interesting question and very, very important one, actually. So when you look at our baby friends, it's very difficult to say what they are feeling, because to communicate that is very difficult. And you find that, especially for a first-time mom, it will be very difficult to know exactly what's going on. So it's different from an older child who would say, "Oh, mom, this and this is paining," and the mom might give some remedies. So for my advice for infants, and specifically if we talk about the young infants who are less than 6 months, I wouldn't advise home remedies until clinical personnel looks at the child and recommends something. The important thing is a mother will know that something is definitely wrong with the baby. So the mother knows the normal pattern of the baby, the normal behavior of the baby, the feeding patterns, how many times this baby goes to the toilet, and what the baby cries for, especially like when the baby is hungry. She knows that the baby will be consoled. But so those subtle signs, when they start coming in, obvious things will be like an infection. And I always encourage my mothers when they come to the clinic, I always ask, do you have a thermometer at home? So she could easily check the temperature of the baby, could check the consistency of the stool for the baby. So if she finds something worrying or the temperature is high, of course we have things like you can undress the baby and make the baby feel cooler, but that's on your way to the clinic. So for babies, there's no time delay. Time factor is an important thing. So the moment that something worrying pops up, I'd advise to rush to the nearest clinic and start administering home remedies.
Interesting. Yeah. Interesting. For the sake of maybe a mother out there, like you mentioned, somebody who is just new in the motherhood family.
Yeah.
Why is it that in most cases babies tend to be troublesome at night?
At night. Okay. Another interesting. Yeah. So it's like you're saying, it's a very common complaint to say this baby is more irritable at night. So now again, what are the circumstances around that period is what we try to find out when such a complaint comes. So we try to go into the details of what is the feeding history of this child. How is this child going to the toilet? How is the breathing? How is this child having any cough or any problems like that? How irritable has this child been? So when we categorize the conditions that may cause excessive crying into medical and surgical, you can add a third category under which colic falls. So, and I'm sure that's why we have zeroed in on colic, because it's a very common cause of excessive crying. And like you have asked, colic is one of those things that commonly happens at night, actually. And so that's one of the things you might want to consider when you're evaluating such a baby.
Maybe it's about time that now we get into colic and, of course, just get to know exactly what this condition is all about and, of course, how it affects the health of the baby. Yeah. And, of course, your messages are coming through on 0955 5016, 0955 5016. In case you have observed something, in case you have got a question, please be free to send us that question via that number that is scrolling on your screen, and I'm sure that my guest should be able to respond to that. To start with, what is colic?
So colic is one of those conditions that is described to be benign. So in the medical term, when we say benign, we're talking about a condition that is not really dangerous or causes any adverse effects on the baby. So it's one of those benign conditions that causes excessive crying in a baby. So it comes in like episodes of excessive crying, which lasts more than at least 3 hours or more. Of course, some babies would have shorter periods, but by the working definition, you find that this is a baby who's crying excessively for 3 hours, for more than 3 hours per day. And it's not just on one day. You find that even more than 3 days per week. And this is a condition that will go on for weeks, maybe 3 or more weeks. So it's not just something that has happened on one day, but you find that in the history, it will be prolonged.
Interesting.
Yeah.
How common is colic in Zambia?
It's extremely common, not just in Zambia, but it's a condition that is known worldwide. So in infants, it's very common in infants who are below the age of 6 months. Very commonly it starts around 6 weeks of age. Shows the baby was born well. Mom went home with the baby, has been feeding well, has been going to the toilet just okay. But then somewhere around 6 weeks, you find that the baby starts having these periods of unconsolable crying. Even after being breastfed, even after being changed, the baby continues to cry for a prolonged period. And this is a high-pitched cry, not that normal low-pitched cry of hunger. So from 6 weeks, usually it starts resolving maybe about 3 to 6 weeks, 6 months. It would have resolved. It's very rare to see it in infants who are older than 6 months.
Okay.
So maybe worldwide you'd say the incidences vary, but we can say up to 40% of infants will experience colic. So it's very common.
Could it be genetic?
So that's one of the questions actually that came up early on in research. Is this a genetic condition? So in fact, there's no genetic condition that has been linked to it. So it's not a genetic, it's not inheritable. It's not like if the parents had colic and then the baby will also have colic. So it's not one of those conditions that are inherited.
Interesting. So now, if it's not an inherited condition, then what causes colic?
Okay, so the medical world is still struggling with that. No one knows exactly what causes colic. Okay, we know the signs and symptoms, but no one knows exactly what causes colic. There are certain areas, of course, that studies have focused on to answer that question. Okay, so some of the things that have been looked at are, we know that everyone has got normal bacteria, normal flora in the gut. So initially that was thought to play a role. So studies have looked into that. There's theories concerning the maturity of the intestines. You find that the nerves that serve the intestines, some people have proposed that maybe they're not mature enough. And instead of sensing the food that the child is taking or the normal bowel movements, instead of sensing them as a normal thing, they sense it as pain. So that is one of the theories to say the immaturity. But by and large, up to now, no one knows exactly what causes colic.
Interesting.
Yeah.
I've heard a couple of people talk about some of the common myths that are associated to such conditions.
Yeah.
Sometimes it might be linked to it might be linked to the kind of feed that you're giving to your child. It might be linked to the fact that maybe the mother's milk is not healthy.
Yeah.
It might be linked to some sort of black magic. It might be linked to all these issues. Exactly. Yeah. In fact, I've even seen some babies taken to church to be prayed for. Other babies taken to church to have an early baptism, and of course other babies taken to witch doctors, and of course given all these herbs and all that.
Yeah.
Exactly. So now, could colic in one or the other be associated to what you're feeding your baby?
So the behavior that you're describing, where you find that parents are going from one doctor to another, or maybe are resorting to some of the examples that you gave, it comes out of desperation, because you find that even if you try this and that, most babies will not respond. Okay, so it's there already. If you have things like that happening, a lot of people come up with these myths to say maybe it's the milk of the mother. Some babies who are formula fed, some people think it's the formula milk that the baby is reacting to. Even even just the mother itself. Some mothers have been blamed to say maybe it's the problem of the mother. She did something during pregnancy, things like that. But by and large, colic is not associated with the types of feed. It doesn't matter whether the baby is breastfed or not. It happens to babies who are breastfed. It happens to babies who are formula fed. It happens to babies who were born by cesarean section, who were not born by cesarean section. It happens to babies who were born prematurely and those who were born on time. So all that would tell you that virtually no baby can escape or might escape colic, just depending on what type of feed they are getting or how they were delivered. So it's a very general thing. No one knows what causes it.
Interesting.
Yeah.
So if that is the case, then how is the diagnosis done at the hospital? Is there any other special test or any special test that is used to make sure that the diagnosis is done?
Okay. So colic is a diagnosis that is made by what is known as, it's a diagnosis of exclusion, as we call it. So by that we mean, since we know that colic is one of those things that is not caused by an organic or a physical thing that is gone wrong in the intestine. It's not because the intestines are twisted, it's not because there's constipation, it's not because there's diarrhea. So essentially we have to evaluate the child and see whether there are any other possible causes of why this baby is crying excessively. So that's the number one step. Before you can make a diagnosis of colic, you have to make sure that all these danger signs are not there. Is the child having fever? So you probe, you ask the mother or the father all these questions to try and see, could we find a possible cause to why this baby is crying excessively? Is there fever? Is there a cough? Is there vomiting? Is there diarrhea? Is the stomach or the abdomen, is it distended? And so forth. After we have screened for all those possible in there, just from interviewing the mother and doing possible tests to rule those things out, after you've done all that and you're satisfied, definitely this is not an infection, it doesn't have an ear infection, doesn't have a throat infection, then we can safely say, okay, most likely this child has colic. So it's a diagnosis that you pick up just from the history. There are no tests specifically that will say, let's do this test and it will show us whether the baby has colic or not.
How long does it take to diagnose colic?
So this is a diagnosis when the patient is brought to the clinic and you start going through the details. When was this baby born? What is the feeding pattern? How is the child breathing? Any diarrhea? So that interview might take anything from maybe 15 to 30 minutes, depending on what's there. If you find that all those red flags or the warning signs are not there, it's a very short period to make a diagnosis. So you won't find parents being given a review date coming in again and again into the hospital until it's made. So if there are no warning signs, it's a very straightforward diagnosis.
Interesting. And of course, what are the outcomes of a baby, who is suffering from colic? Does it cause any complications?
So I use the word benign. So that's the word that's used if the condition is sort of, say, harmless. So it's one of those harmless conditions, but the main complications that we have, if I can call it a complication, is a complication in the parents. So what do I mean by that? So it causes a lot of anxiety, actually. And most parents feel, even some might be depressed over it because they just can't do anything to relieve the child. So a lot of parents have a lot of anxiety to it. But in terms of the baby, it's not that it will affect the growth, it will affect the brain development. There's nothing like that. There are no long-term effects. Of course, very small number might have unspecific abdominal pain later on in adolescence, but it's very benign, it's very harmless.
Interesting.
Yeah.
One of the key issues that I think I forgot to raise earlier on was to do with what usually happens in many of these communities, and maybe perhaps as you're talking about no major complications and of course how to deal with it. in many communities, you'd find that there is a lot of exchange of knowledge and ideas that really goes on, especially among mothers.
Yeah.
You'd find that this mother would actually come with a problem. It could be that the child has got colic or something.
Yeah.
And of course, they would be saying, but my child has just been crying and all that.
Yeah.
And you'd find that, other concerned mothers would come in and would definitely refer to what they went through some time back.
Yeah.
Oh, even my child was actually doing that. And I gave my child this type of a product. I gave my child this and that and that. I went into a chemist, I bought this and that and that. I don't know how healthy that is.
Yeah, so, it's one of the things that we struggle with in the health profession. There's a lot of information in our communities. I would say most, which is not beneficial or true. But it's, there's power in the information that is disseminated. Before even a professional can come in and say, this is what could be happening, we are very quick to believe a non-medical person.
Mm-hmm.
So it happens a lot. It's not just for colic, but for a lot of other conditions. So the danger with that is you might miss out these warning signs that we've been talking about. So as a parent, especially for first-time mothers, you might miss out very subtle things that could point to an infection, which could be treated early with simple medicines. If only a medical personnel picked it up. So if you have these people coming in and advising, this is what happened, excessive crying could be caused by a number of things. So maybe what caused the excessive crying in their baby is very different to what is causing excessive crying in this particular baby. So if you recommend one treatment to feed all excessively crying baby, that is very dangerous. And for over-the-counter medications for infants, I'm one person who's very against that. As in, just going into chemist and getting medicine for a baby who's less than 6 months, it's a very dangerous practice. Yeah.
We're still discussing colic and, of course, excessively crying babies. For now, we take a break. When we come back, we'll also try to go through our inbox just to look at what are some of the questions coming from the audience that is watching the program. Otherwise, we are discussing colic once again, and of course, keep those messages coming. And I'm sure that my guest should be able to respond to most of them. We'll go for a break.
I'm a shooting star leaping through the sky like a tiger. I'm gonna go. There's no stopping me. I'm burning through the sky. Yeah.
With over 500 flights every day, Emirates brings the world together through Dubai. Fly Emirates for a world of good times.
I'm having such a good time.
We bring you the best music videos, all genres, every day 12 hours to 13:30 on your favorite channel, QTV. Ngoma. Ngoma, every day 12 hours to 13:30.
We love local. All of your favorite Zambian hits. And much more. Z Rampage, Fridays 9 to 12 on QFM.
we bring you the best music videos, all genres. Every day, 12 hours to 13:30 on your favorite channel, QTV. Ngoma. Ngoma, every day 12 hours to 13:30.
Kings are born and not chosen. In one kingdom, the first generation, where people are happy with a lot to celebrate about. But when the first chief in Sofwa dies, it's the playful grandchild who takes over, Chief Muzo, and the palace is turned into a common house. Chief Muzo rules.
I am the king.
There is drama.
You are going to marry these 3 women.
If he was here, I could have stabbed him to death.
Possibly the question that I would love to pose to all the mothers out there, especially those who are definitely watching, is when you notice that your baby is excessively crying and you suspect that it could be colic, what do you do? What steps do you take? What are some of the things that you give to your baby? I'm sure that, growing up, I think, there was a time when gripe water was quite very common, especially among mothers. You'd find that they could walk into a chemistry, buy gripe water, get, baby oil. Others could even administer the original cooking oil. They could, maybe somebody could have told them to say, no, just get to salad, others could even get, juice from an orange, and so on and so forth, just to help the child get comfortable. Now, the question is, well, are those methods really very helpful? Are they healthy at the same time? I'm sure that, you might be a mother who has done such things before, and you're waiting to hear whether it's healthy to do that or not. So let me push it to my guest today. Is it healthy? I'm sure at some point, gripe water was was one of the most common, product that every mother could carry. Wherever they are going, they would definitely carry, just like they could carry powder and the rest. Gripe water used to be there. So now, when a child is crying excessively and the mother possibly just suspects it to be colic, she could get gripe water, feed it to the child. I don't know.
Yeah. So very true, Nelson. So gripe water is one of those very common things that has gone back, that information has been passed from generation to generation. Of course, there are other common things that are commonly used in the households. So you would hear a mother being advised to give some freshly squeezed orange juice, some sugar solution. But by and large, most mothers would even end up giving some form of a herbal medication. Mm-hmm. There's an over-the-counter medication that I'm very reluctant to mention the name, but it's a very common medication that is bought over-the-counter, a herbal medication, which is thought to help in colic. Other things, of course, like even just the way the breastfeeding is done has been passed on and so forth. But by and large, all these things, none of them has been proved clinically to say they're effective. And so as pediatricians, we do not recommend them beforehand to say this is the baby this is the medication which you are supposed to give to a baby with colic. So no studies have really confirmed to say they do work.
Okay.
So again, I will not be quick to say definitely completely stop, because they have not been proven the other way as well. But by and large, all those things do not have been shown not to work.
Okay.
Yeah.
Interesting. All right. So our first text here says, why do babies usually cry between 0 to 3 months, and why do they stay awake in the night during the same period, Erica?
Okay. I think if just like we mentioned, I'm sure Erica had noticed that we we had talked about when commonly this colic appears, and we said it usually is noticed in the night. Reasons for that are not completely known, but we do know just from the reports that this is a condition that is commonly seen in the night. And so when she says it happens between 0 and 3 months, we had mentioned that colic usually starts around 3 or 6 weeks, and by 3 to 6 months it would have stopped. So that is actually the prime period between which colic occurs. So that could tie in with colic actually.
Okay, if colic, or maybe is colic associated to any season, any kind of weather?
Again, seasonality has nothing to do with colic. So whether it's the dry season, whether it's the cold season, it has nothing to do with the time of the year. So it happens throughout the year. It happens to any type of baby, like I mentioned. So no, it's not.
Our second text here says, good afternoon, doctor. When my baby gets a colic problem, she gets a very high temperature that leads to her having seizures or convulsions. This happened 3 times now. Does it ever go away? Is there something that maybe I'm not doing or feeding her? Worried mom.
Okay. Yeah, that's very worrying. So I'm not sure if she mentioned the age of the baby.
The age is not indicated.
The age is not indicated. Okay, so she might be describing, so we said colic is one of those things that shouldn't have a warning sign. So we had said one of the warning signs are fevers, including convulsions, where you say maybe there's meningitis. So once those things come in, it is not a diagnosis of colic. You cannot call it colic. Okay, so colic, like we said, is a diagnosis of exclusion. You have to exclude that all these things are not there. So the fact that there's fever, the fact that there's convulsion, this is not colic. Of course, the two can be happening at the same time, but we cannot say colic is the one that's causing the fever. Colic is the one causing the convulsions. But I think what she's trying to describe is a child with a febrile convulsion. Okay, so this is a child, usually it happens between 6 months and 5 to 6 years. So a child who will have a fever, there are some who are predisposed. If they have a fever from, let's say, tonsillitis, if the temperature goes up, they will convulse. Okay. So these are convulsions called febrile convulsions. It's not because they have a brain infection or they have a brain malformation. They are convulsing because of a fever, regardless of the cause of the fever. So it could be a fever coming from a urinary tract infection. It could be a fever coming from an ear infection. As long as there is fever, some children convulse. And so we say it's between 6 months to 6 years. So it's rare to find it after 6 years. And so febrile convulsions, I would say they will stop after that period.
Okay.
Yeah.
So what should she do?
So definitely she has to get to the nearest clinic, see a physician, a pediatrician, and who will ask her some questions, take her through a short interview, and to see when this happens. Is it always the convulsions, are they always associated with fever, which is a very common pattern for febrile convulsions. There are certain things, of course, that if it is confirmed to be a febrile convulsion, that she can do when a child has a fever for whatever cause. So home remedies like to give something to reduce the temperature, like some Calpol, or remove the clothes from the child and start tepid sponging before heading to the clinic. So just to keep down the temperature, and always keep a thermometer at home just to monitor that temperature.
Okay.
Yeah.
Interesting. All right, so your text messages, ladies and gentlemen, are coming through on 0955 5016, 0955 5016. We still have other interesting, questions and, of course, coming through from our audience. But for now, we'll go for a very, very short break. When we come back, there is another text here coming through from another concerned guest viewing our program today, of which I'm sure that, my guest is going to respond to that. But for now, we go for a short break. We'll be back.
Hi, my name is Machamanda. I bring to you the 169 on QTV, your number one show transcending all the imaginable barriers, discoveries, explores, realities, and the dares all in one package, uncovering the beauty of your nature in the air, on a safari, on water. 169. Here we believe the style is the only real luxury really desirable. In the 169, We will take you there. Call us, we shall come there. The world is waiting. Catch me every Saturday at 6:30 p.m. Exclusive QTV.
Lots of love to QTV. Love you.
All right, so welcome back, ladies and gentlemen. Thank you so much to all those who are definitely sending us questions. This one, he says, hi doc, my baby was diagnosed to have a hole on one of the veins attached to the heart. She was prescribed a medicine. Unfortunately, I struggled to read. Now, my question is, can I give my baby Appetito because she is so much underweight? Thank you.
Okay, so that's a very interesting question. So I believe the baby is being followed up, hopefully in a cardiac clinic. So what she's describing is the child was found to have what is called a congenital cardiac abnormality, and of course, rightly so, some medication was prescribed. So unfortunately, such conditions put a strain on the growth of the baby. So there's a condition what we describe as failure to thrive. The baby is failing to thrive because of that problem. So when it comes to the feeding patterns, I think it's best she sits down with a nutritionist who would advise the best way of feeding this child. So Appetito is not the thing that I would recommend. So first of all is an assessment by a nutritionist or even just a pediatrician. The pediatrician, even who is looking after the baby in terms of the cardiac problem, could advise on that. So the feeding patterns might have to be modified, and you can sit down with them to see what's available and what can be done to feed. And also just to monitor the growth. Is this child within the expected weights for such a condition? Because we know it's a strain on the baby's health in terms of putting on weight. Yeah, so it's no rushing to Appetito. I wouldn't recommend that.
My baby has a big umbilicus protruding, and it causes her a lot that she fails to sleep at times. What are some of the causes, and is it associated with colic? Okay, so again, if you suspect or if you have a thing that's in addition to the excessive crying that you can put your finger on to say, for example, this is fever or there's a distension over the umbilicus, then definitely it's not a diagnosis of colic because we know there's something else. Colic, we have to rule out all those things. So now in terms of what she's describing, that's what is called an umbilical hernia. So essentially, in brief, you find that our abdominal wall has got muscles and layers of layers that protect our organs. So some babies are born with a defect in those layers in the muscle. So there's a gap in those layers, such that when the baby, example, cries or coughs, causes pressure in the abdomen, you find that the intestines essentially will protrude through that defect, and that's what that bulging that she sees on the umbilicus. So it's called an umbilical hernia. So it can be
it can be a hernia, can be an umbilical. Other common hernias where the intestines might protrude are just in the groin, and it's called an inguinal hernia. So that is a problem when it becomes a problem when the intestines become stuck in such a hole or in such a defect. And if they become stuck, it becomes a surgical problem whereby the surgeons have to go in and pull them back and close up that gap. So if she's saying it's a big defect and it causes pain, definitely she has to take the child to, the surgeons have to take a look. And it's a relatively simple procedure where they close up that hole so that the intestines do not protrude, because that would definitely cause discomfort and pain. So the surgeons have to take a look. It's commonly done. There are a lot of babies who are born with big umbilicus. Some, I'm sure, some kids grow into adulthood without any intervention because the gap, the hernia is essentially small. But for those who have big hernias or big defects, they have to be closed up surgically. So yes, it can be fixed.
What should we do? The baby, every time the teeth are coming out, has severe diarrhea and vomiting.
Okay. So you appreciate, Nelson, the age group that we're looking at, there are a lot of problems that are associated with that. And there's a lot of anxiety, not just colic. Yeah, so yeah, that's a common thing. So we hear a lot of mothers who come to the clinic, so they might say the child has been having diarrhea, and you ask, why weren't you bringing the child to the clinic? And they say, no, one is a chokaman. So I didn't think I have to bring the child. But it's a common association. When the child is teething, you find that it could be associated with diarrhea. One of the reasons for that is because that irritation that comes with the teething, you find that babies put all sorts of things in their mouth. And of course, we know that if they're crawling, they're touching this and that, and they're biting things just to try and relieve that, they are prone to diarrhea. And so when the diarrhea comes in, it's always linked to the teething. So that's hence that connection. But it's not a direct cause of the diarrhea. It's because
teething is not the common, the direct link to diarrhea.
No, so it's because the baby is trying to, it's either they are painful or they are itchy, and he's trying to relieve that. So he's always putting stuff, biting on stuff, putting the fingers in the mouth. Then you know that the chances of having diarrhea or putting some bugs in the mouth increases. And so
when you're talking about teething and vomiting and diarrhea, especially on diarrhea, it's not normal for a child, or is it normal for a child who is teething to have diarrhea?
So I'm not sure the way you phrase the question, is it normal? So it doesn't mean whenever a child is teething, they should have diarrhea. No, but it's what we call a predisposing factor.
Okay.
Like I mentioned, they will be putting stuff that is not healthy in the mouth, and that is what causes diarrhea. Even if they're not teething, if you find that they are crawling all over the place and putting things in their mouth, they will have diarrhea. So there's that connection. Whenever they are irritated by the gums and they start putting things in their mouth, which gives them diarrhea, people straight ahead connect it to the teething and not necessarily what has been going on in the mouth.
Okay, interesting. You remember the previous text that we just read for a worried mom?
Yep.
Exactly, and of course you did ask if she had indicated how old the child is.
Yeah.
She has actually replied, and she says the child is 1 year, 1 month old.
Is this one was having fevers and
exactly, fevers, higher temperatures, seizures, convulsions. Exactly, the child is 1 year, 1 month old.
Very unlikely to be colic. Like we said, colic usually stops by 3 to 6 months. And if you start having it, or a child who's excessively crying, who's above that age, then we really have to look deep and look what else can be causing that. So again, it fits in the age of febrile convulsions that we described. So like we said, from 6 months to 6 years, that child falls in between that period where children are prone to febrile seizures. So seizures, definitely the pediatrician has to assess, get a history. Is it just febrile seizure, or there could be something else? but at least the pediatrician has to screen and see if it is febrile seizures. But it sounds very much like it's febrile, could be febrile seizures.
My baby cries a lot and in the evening often vomits when being breastfed. What could be the problem?
Okay, so cries a lot. Difficult to put it in one diagnosis, but again, colic is one of those things that that is one of the diagnoses that we can make. But vomiting, I would like to know exactly when she says vomiting, what does she mean? I'll explain, because some of our mothers will mistake burping or regurgitating after a feed to vomiting. So this is a baby who has been breastfed. After she has breastfed, there's a small amount of milk that comes up. You know, everyone knows that after breastfeeding a baby, you try and burp the baby, isn't it?
Mm-hmm.
So usually a bit of milk might come out. So some mothers might mistake that for vomiting. So there are certain characteristics that you might look at and ask in detail to see, is this burping? Is this just burping up or regurgitating? Or is it actually forceful vomiting, which is different? And of course, a child who's vomiting feeds will have other things that you can look at. For example, they might not be putting on weight. So those are the questions that if I met, those are the things that I'll try to dig out.
All right, interesting. Wow, very interesting observations, interesting comments, interesting questions from different, viewers, and of course from different people making up our audience. But now, just to sum it up, in case a mother notices that the child has got colic, what should the mother do?
Okay, so number one, Nelson, I think if she suspects that the baby has colic, I think it should be confirmed by a trained professional. So if she suspects that this is just colic, the baby is excessively crying without being consoled, take the baby to the nearest clinic. They'll go through details, they'll examine the baby, and if they say, fine, this baby doesn't have anything else that's wrong, then they confirm the diagnosis of colic. The most important thing is she should be reassured that this is a condition that will not harm the baby. Okay, it will not have any long-term impact on the baby. And so we can explain to her that this will go away eventually by 3 months to 6 months. And that's one of the most important, in terms of the treatment, we have to reassure the mothers when we make a diagnosis of colic that this is a benign, it's a harmless condition. It might cause a bit of distress, but the more information they have about the condition, actually, even that anxiety tends to go down. So they know, okay, fine, the baby is going through this period of colic, but eventually it will stop without any harm to the baby.
Well, Doctor, thank you so much for coming through today.
Thank you for having me.
Thank you so much for your time and, of course, for the information that has been available to the general public. Obviously, that we always have mothers who would really, really have fallback questions. We always have a lot of questions, but I'm sure that with such an interaction, I'm sure that mothers will be getting the help that they need.
Thank you very much.
Appreciate it. All right, so ladies and gentlemen, our time is up for today. Make sure that you join us next Sunday when we come through to discuss another interesting item. It could be, it could be something related to, convulsions, and of course it could be something related to vomiting, but it could be anything related to the health of a child. So remember, this program is strictly discussing the health of infants. So if you're a mother and of course you're expecting, and you're a father, you're expecting and all that, you really, really need to pay keen attention to what will be discussed here, as we'll be helping you really on how you can definitely ensure that your baby is health. And in case there is a complication, there's a healthy related problem, you definitely know exactly where to go to. But obviously, carry home information as of today. Take home information is that don't self-diagnose a condition. Every time that you notice that there's something wrong with your baby, make sure that you call your doctor, you take your child to a health center, a clinic, a hospital, so that a professional diagnosis should be done and correct medication should be prescribed on your child. Yes, there's a lot of information flowing in our community, but make sure that you rely on information that is coming through from doctors and, of course, experts of, this particular profession. I've been your host, Nelson Zulu. Until next Sunday, it's bye-bye.